So Elliot just finished with a neurosurgery rotation with us, which was probably the best month of his life, right?
It was.
And what were you thinking going into the rotation? What was concerning to you, and why did you choose to do a neurosurgery rotation?
I think for me, I want to go into surgery, and being able to have exposure to neurosurgery was like a unique opportunity, and something that I wanted to take advantage of. But as far as concerns that I had prior to the rotation starting, I think I was definitely a little bit stressed just about the fact that it was going to be neurosurgery, and there's some, mystique as far as like what that entails. I think my perceptions as far as like what I was concerned about and the stress of, being in the OR during brain surgery or spine surgery, I had built those up myself, and then I think being with you and your team definitely put me at ease, and allowed me to learn a ton, and be in that setting just was an opportunity, that I'm thankful that you were able to provide for, me and hopefully future students.
What are things that medical students should, in your opinion, do to prepare for a surgical subspecialty rotation, and in particular neurosurgery?
I think it varies, but I think if you're taking the rotation like as an elective rotation in third year or fourth year, whether you're going into neurosurgery or a different surgical field, or even if you're not going into a surgical field, I think that just taking it upon yourself to do some reading. I think what I did was I went into our database and I just looked at a couple of different journals. I looked at the spine journal, and just tried to do some research on the cases that we had. Like once I got a feel for the cases that you were going to do the next day, just trying to look at what does a lumbar fusion look like that's minimally invasive. What are the things that I should know? Reviewing anatomy I think is important, just so that you can have some awareness in the OR as far as like what they're doing, what the steps are. I think that that's important, and then being able to ask questions of the team, like being able to ask you questions, and then having that direct my outside reading was something that I think any student should take upon themselves, especially within a subspecialty like neurosurgery, because there's so much to know. But if you can just get some understanding for the basic overall concepts of the things that you're doing, the operations you're doing on a daily basis, that will help you thrive on the rotation and really enjoy it.
What were some things that you learned on the rotation?
Oh, I learned a ton. I think the thing that I took away from clinic and in the OR was just the ability to read an MRI and look for nerve impingement when we were looking at we had a couple patients that had cervical myelopathy, like being able to see that, and then following them in clinic and looking at their post-op imaging as far as like what we'd done for the stabilization, like if we did a fusion. So I think my ability to read imaging drastically improved on the rotation. I now feel comfortable looking at an MRI of the spine and that type of stuff. The other things that I learned on the rotation, just the way that you're setting up your practice, as a surgeon that's in private practice, I learned the business side of medicine, and for me, that was something that was super, super rewarding. Just kind of being able to see how, with medicine moving more towards a corporate scope, you're kind of, I guess I would say, like fighting back against that and still having the physician-led private practice, and seeing how you're setting it up to be nimble was something that I'll take forward in my career and be able to implement, hopefully, whether I'm in private practice or in a group setting. I think the things that you're doing were they're unique, and they made an impact on me. And then the other thing that I learned was just the, you're using a team approach to managing, complex spine, and that team approach is something that I don't think gets hit on enough, and being able to interact with these different providers, whether it's a PA that's in the clinic, a nurse practitioner, bringing in the pain management docs, having your grand rounds. That was something that I feel privileged to be a part of.
Good. Well, it was really good to have you the last month, and it's good for us, I think, to have students. We learn from you, you learn from us, and I hope that medical students don't have trepidation or fear about some of the surgical subspecialty rotations. I think that there's some grumpy people in medicine in all fields, and especially in neurosurgery, but there's also some people that are willing and happy to engage in the process of education. And I think that there's a lot of exposure to many of the aspects of medicine that are available in neurosurgery, inpatient, outpatient, in the operating room, in the ER, ICU floor, the engagement with lots of other subspecialists within the community. So thank you for spending the time with us.
Yeah, thank you for having me. It's been an awesome experience. So if you have the opportunity to go on neurosurgery, especially, I would say don't be afraid of what you're getting into. You're going to learn more than you could ever imagine, and you're going to see rewarding cases and patients that you're changing their life, and then you're going to be able to see some difficult conversations, and I think that's something that we don't get a lot of exposure to within medical school. And so watching how to have those crucial conversations with patients regarding end-of-life care and that type of stuff is something everyone should take advantage of if they have the opportunity to do that. And I think neurosurgery presents a unique opportunity to see surgical intervention making life-changing differences, but then also having important conversations and helping facilitate families navigating those difficult topics.
Definitely. Thanks.
Mm-hmm.